Dear nursing student, welcome. Sit comfortably with a long spine, resting your hands on your knees. Gently close your eyes and inhale slowly, expanding your rib cage, and exhale fully, releasing any tension around your face. Today, we're blending yoga with endocrine and biochemical insights. The endocrine system, pituitary, thyroid, adrenals, pancreas, gonads, relies on precise hormone release and regulation, while biochemical processes like negative feedback loops and receptor binding help keep your body balanced. As a nursing student, consider how stress can disrupt these processes for both you and your patients. Set an intention to move mindfully. Listen to your body, keep your spine long, and maintain steady breath control. Let's prepare with a gentle warm-up to connect breath, body, and mind. We'll begin with seated neck and shoulder rolls. Sit tall, lengthening through the crown of your head. If you feel discomfort, reduce your range of motion and keep your breath smooth. On inhale, roll shoulders up toward your ears. When you exhale, roll them back and down. Repeat for 3 to 5 slow cycles, each cycle following one full breath. Gently tilt your head side to side for 2 to 3 breaths each side. While you do that, it is time for an endocrine insight. Lowering tension in the shoulders and neck can reduce cortisol output from the adrenal glands, indirectly supporting the thyroid and other glands. Now time for a clinical insight. Patients with high stress often present with tension headaches or elevated blood pressure. Simple neck and shoulder releases help alleviate these symptoms, reducing adrenal strain. And a biochemical insight. Elevated stress triggers the hypothalamic pituitary adrenal HPA axis, increasing CRH, corticotropin-releasing hormone, from the hypothalamus and ACH from the pituitary, which then raises cortisol. Relaxation techniques can help downregulate this biochemical cascade. Let's move on to wrist and finger stretches. Extend your arms at shoulder height. Keep your spine upright and chest open. Move gently, matching your motion to your breath. Inhale. Spread your fingers wide. Exhale. Gently form soft fists. Rotate wrists clockwise for 3 to 5 breaths, then counterclockwise for 3 to 5 breaths. Here's an endocrine insight. Healthy circulation ensures hormones like insulin, cortisol, and thyroid hormones reach tissues effectively. Clinical insight about your wrists. Nurses often perform repetitive tasks, IV insertions, charting. Good wrist mobility and circulation can help prevent strain and maintain steady hands when administering medications such as insulin. Here's a biochemical insight about the endocrine system. Hormones like insulin and glucagon from the pancreas travel via the bloodstream to target cells, binding to receptors that trigger second messenger systems, for example, CAMP, modulating glucose uptake and release. Optimal blood flow supports efficient hormone receptor interaction. Place one hand on your belly, one on your chest. Keep your spine long and shoulders relaxed. Inhale to a slow count of 4, feeling your belly rise. Exhale to a count of 4, letting your belly fall. Continue for 5 to 6 full breath cycles, staying present with each inhale and exhale. While you do that, think about this endocrine insight. Deep breathing lowers stress hormones, benefiting the pituitary, thyroid, and adrenals by reducing the body's fight or flight signals. You can teach patients these breathing techniques to help manage anxiety or panic attacks, which can accompany endocrine disorders like hyperthyroidism. Slower breathing helps maintain optimal carbon dioxide, CO2 levels, which influences blood pH. A stable pH is crucial for enzyme function and hormone receptor binding, helping maintain metabolic balance. Now let's move into a flowing sequence, each pose targeting different endocrine glands while we explore deeper biochemical layers. The cat-cow stretch or Majriyasana Bitilasana. Come onto all fours, wrists under shoulders, knees under hips. Keep your neck in line with your spine and flow gently with each breath. Inhale, cow. Arch your back, lifting chest and tailbone. Exhale, cat. Round your spine, drawing belly button in. Flow for 6 to 8 slow cycles, matching 1 breath per movement. This gentle spinal movement increases circulation around the neck and head, subtly supporting the pituitary gland, which orchestrates hormone release for growth, stress response, and metabolism. Back tension is common in nursing due to long shifts and those big olatides. Cat-cow can help reduce stiffness. Patients with pituitary disorders, for example acromegaly, often need low-impact movement to maintain joint flexibility. The pituitary releases hormones like TSH, ACTH, GH, FSH, and prolactin. These hormones act via negative feedback loops. For instance, TSH stimulates thyroid hormone release, which in turn suppresses TSH when levels are sufficient. Now let's move into a seated forward fold, Paschimottanasana. Sit with legs extended. Keep your spine long as you hinge at the hips. If hamstrings are tight, bend your knees slightly. When you inhale, lengthen your spine. And now exhale. Fold forward, reaching for your toes or shins. Hold for 5 to 8 slow breaths, deepening with each exhale. Forward folds help calm the nervous system, indirectly benefiting the thyroid gland by lowering overall stress. In hypothyroidism, patients may experience fatigue and muscle stiffness. Gentle forward folds can improve circulation and relaxation, potentially easing symptoms. The thyroid produces T3, triiodothyronine, and T4, thyroxine. T4 is converted to T3, the more active form, in peripheral tissues. Stress can inhibit this conversion. A calmer state may support optimal deiodinase enzyme activity, aiding proper T3 production. Great. Now let's move into a low lunge with a twist, Anjaneyasana variation. From a kneeling position, step your right foot forward. Inhale, lengthen the spine. Exhale, twist to the right. Use a cushion if your back knee is sensitive. Inhale, lift your chest. Exhale, place your left palm on the floor or a block, twisting to the right. Hold for 5 slow breaths, then switch sides. Twisting gently massages abdominal organs, including the pancreas, insulin/glucagon, and adrenals, cortisol, aldosterone, supporting better circulation and potentially aiding hormone regulation. Diabetic patients or those with adrenal issues like Addison's disease may benefit from gentle twists to reduce abdominal tension and support blood flow. The pancreas houses alpha cells, secreting glucagon, and beta cells, secreting insulin. Glucagon and insulin work antagonistically to regulate blood glucose. Meanwhile, aldosterone from the adrenal cortex controls sodium reabsorption, influencing blood pressure and fluid balance. Moving on to bridge pose, Setubandhasana. Lie on your back, knees bent, feet hip-width apart. Keep your spine neutral before lifting and maintain steady, controlled breaths. On inhale, press into your feet and lift your hips. Interlace fingers under your back if comfortable, grounding your shoulders. Hold for 3 to 5 slow breaths, then lower on an exhale. Bridge pose enhances blood flow to the pelvic region, benefiting the gonads, ovaries, testes, responsible for estrogen, progesterone, and testosterone production. Reproductive health issues like PCOS or low testosterone can improve with gentle exercises that increase pelvic circulation and reduce stress. The HPG axis regulates sex hormone production. GnRH from the hypothalamus stimulates LH and FSH from the pituitary, which act on gonads to produce estrogen, progesterone, and testosterone. Balanced hormone levels depend on feedback loops modulated by stress, sleep, and physical activity. Having stimulated these key areas, let's move into a guided relaxation to integrate our efforts. Savasana, corpse pose, with visualization. Lie on your back, arms by your sides, palms facing up. Keep your spine aligned and your shoulders relaxed. Allow your breath to settle. Let your feet naturally fall open. Stay here for 10 slow, full breaths, letting your body be heavy against the mat. And visualize when you inhale. Picture a warm, golden light traveling from your pelvic region, gonads, to your navel, pancreas, lower ribs, adrenals, throat, thyroid, and brain, pituitary. Exhale. Release tension, feeling yourself sink deeper. Patients with anxiety, insomnia, or chronic pain often experience dysregulated endocrine function, for example, elevated cortisol. Savasana can help lower sympathetic overdrive, supporting recovery. Cortisol follows a diurnal rhythm, typically highest in the morning and lowest at night. Relaxation can reduce excessive cortisol release, helping maintain normal circadian hormone patterns that support sleep, mood, and metabolism. Gently wiggle your fingers and toes, awakening your body. Roll onto your right side, pausing for 1 to 2 slow breaths. Press yourself up to a seated position, keeping your spine long. You deserve some encouragement. Remember, mindful movement and controlled breathing can recalibrate both mind and body. You've nurtured your endocrine health. Carry this sense of clarity with you. Bring your hands to your heart center. Inhale deeply and exhale slowly. Reflect on how these poses, breath techniques, and biochemical insights help maintain a balanced endocrine system, one that thrives on feedback loops and receptor sensitivity. Thank your body for its resilience, your mind for its focus, and your spirit for showing up. Namaste, and thank you for practicing with me today.